General Evaluator, fellow Toastmasters, honored guest, and unfortunately Carol's not here. Well, maybe we'll put the video of the evaluation on the website so she can hear it. It's often said that a very important part, probably the most important part of any speech is the opening. And you want to do things in your opening that are going to engage your listener. And there's a number of ways you can do that. You can ask a question, you can give a startling statistic, you can give a quote. What Carol did in her speech is she asked some questions. So right away by asking questions, you engage your listener. If your listener is doing texting on their cell phone or reading something else, they have to stop what they're doing to listen to your question and respond to your question. If they're not going to respond, at least think about what you're saying. In her speech, she asked a question about ethics, and she said, what are ethics? And then gave a definition of the ethics. And then she asked us why the ethics are important. So in asking both of these questions, she engaged our attention and stimulated our imagination. She then did another thing to further stimulate our imagination. She asked us to imagine something. And she specifically asked us to imagine what it's like to be one of these foreign patients who don't speak our language, and what it's like for them to interact with the medical system. And she asked us to close our eyes to do that, but you don't necessarily have to close your eyes when you do that. Just by asking people to imagine something or to think about something, you engage their attention. That's the things you want to do in your speech, and that makes your speech very effective. The other thing she did that I like is that she used examples and stories. She read the code of ethics for her profession, and I don't remember what the code was, but I do remember the stories and the examples that she gave. So that just shows that you can give a list of things or a statement, but to illustrate your statement, and in this case the code, it's more important to give an illustrative story. So she gave us the story about the patient cursing at the doctor. Yeah, that's happened to me, so I remember that. And she gave the story about telling the patient about her cancer against the daughter's wishes. So I remember both of those. So that's very important. Now in terms of improving your speech, Carol, first of all, I would say you were very relaxed and comfortable during your speech, but you may have been a little too comfortable, a little too laid back. I would suggest that you be a little more enthusiastic, a little more lively, a little more happy. And that also engages people's attention, because if you're happy, that kind of feeling spreads to your audience, and that also helps your speech. And the other thing I would suggest is paying more attention to your movement and gestures. A lot of your movement was random. I would suggest using your movements and gestures to specifically illustrate what you're trying to say. So those are my suggestions to you, and those are my recommendations. Thank you. Man, just missed that danger zone.
Now moving